Hello, everyone. I'm Fred Rotnick, faculty in the PA program at St. Louis U. And today I'd like to share with you what we affectionately call a Fred Talk. In this presentation, we're going to give an introduction to clinical values in ethics, or as we also call your ethics course during your clinical year. We had a great time this past year going over ethics in real time and professionalism. What this module introduces is how we're going to come together as a group in each mega block to discuss ethical principles as demonstrated in TED Talks, as well as ethical experiences, conundrums, questions that you have during your clinical rotations. As before, we'll use our documents, the AAPA Guideline for Ethical Conduct for Physician Assistant Profession, the PAEA Code of Ethics, and then the competencies for Physician Assistant Profession. These will be our core documents that we'll use to guide discussions around ethical decision-making. The objectives of these series of meetings and discussions will be to define and differentiate among values and ethics in healthcare. We'll identify values of the Jesuit Catholic tradition in the PA profession, and we'll discuss the relevance of these traditions to our own clinical experiences. We're going to identify professional ethics in clinical care that are core to a 21st century approach to clinical care. And then we're also going to apply these values and ethics very practically to provide effective, safe, and appropriate care. When we talk about values and ethics, values reflect a person's sense of right or wrong. They're often aspirational. In other words, in a perfect world, well, how would these values show up? What are these senses of right or wrong? What can we do or achieve as individuals? Ethics forces us to take a look at what we consider good and bad behavior. What are our guidelines for conduct? How do we act as a PA? Every profession tends to develop their own set of ethical guidelines, which are very much tailored to that profession. There's common guidelines we have as healthcare professionals, but there are also guidelines which more specifically address our scope of practice and what we do in the profession. We wouldn't be really honoring our tradition without taking a look at the glossary of Jesuit terms. We've addressed these when we met as a group. The previous time we addressed ethics in real time, but I've relisted them here so you could again review what these Jesuit terms are and why they are important for us moving forward. A link to these terms is included on the bottom of this page. So let's take a look at the principles of healthcare ethics that we will focus on in this course. There are 4 core principles that we've discussed before: autonomy or self-determination, justice, beneficence, and non-malfeasance. We'll introduce 3 more healthcare ethical principles for this course, and those are confidentiality, role fidelity, and veracity. Autonomy is, again, the ability to make one's own decisions, make decisions on one's own resources, and not to be manipulated or forced into a decision by someone or something else. This is important so that we recognize a person's competency, their ability to understand and make decisions, as well as capacity. Competency tends to be more of a legal term. When we're talking about capacity, that's about the ability of someone to make their own decisions. So as healthcare professionals, we tend to talk more about capacity. Does somebody understand the implications of their decisions around an activity or a lack of activity in healthcare? Um, Self-determination or autonomy also speaks to the individual's ability to act on their decision and our ability as providers to respect the autonomy of others. And really, in all settings, as much as possible, allow that decision to be made by the individual patient. Topics such as informed consent and patients being fully aware of side effects of medication and possible adverse events of procedures also falls under autonomy. Justice refers to fairness, equity, and impartiality. Distributive justice is important, particularly in our tradition, and really pushes us towards health equity. How do we provide the right resources to the right patient and to the right populations so that people have equal opportunity to thrive and to be healthy? This is a topic of great concern today as we look at racial inequities, institutional racism, and other imperfections, to use a nice word, in how we have typically provided health services and healthy environments. When you do direct patient care, it's striking how much one's environment affects the well-being of the patient you're caring for. You realize that you have a very limited time with a specific patient. And that's why, as you get to know patients and you start identifying treatment plans and creating treatment plans for a given disease or condition, you want to be more aware of your patient's environment so that the treatment plan is relevant and is something that the patient can achieve. Beneficence is the idea of promoting health and well-being for your patient above all other considerations. It's that idea of wanting the very best for your patient in the scope of what you can provide. Non-malfeasance is kind of the flip side of beneficence, but it's the low bar. And the low bar means first, do no harm. Primum non nocere. What that means is that the very minimum that you do when working with a patient is make sure that the intervention you're proposing, the medications you're proposing, and the choices your patient make minimize harm to that patient. And it also means that we want to be careful when we talk about issues of providing patient care to an individual. We're also being mindful about the justice arguments and how a patient's action or a procedure you're providing might have an impact on broader health. An example of this is infectious disease. You want to make sure that your patient understands if a disease is infectious, what they can do to minimize the effect on those your patient comes in contact with. Confidentiality is essentially the ability to keep secrets. Keep confidential the conversations you have with your patients. HIPAA, the Health Information Portability and Accessibility Act, has some very strong guidelines on what can be revealed in health information and what cannot. If you have not already, you will be provided HIPAA training so that you're comfortable in what you talk about with a patient and you're comfortable with what patient information you might be talking about with others or in a public space. Duty to warn is one time that you may violate this confidentiality if a patient threatens to harm him or herself or others. These are things that you will find more about, particularly during your psychiatry and mental health rotations. Role fidelity is something that PAs model in their daily practice. And role fidelity essentially means staying in your lane. Be faithful to the scope of services for which you are licensed to provide. The cool thing about being a PA is that the scope of those services reflects that of your collaborating physician. So scopes may broaden, scopes may narrow, depending on the practice in which you are practicing in. Providers stay true to those roles, and you make sure that you're not doing things in an area that you're not licensed to provide those services. Veracity is truth-telling. Again, we need to tell our patients the truth as much as possible. It doesn't mean we always tell everybody everything in excruciating detail. It depends on the setting that you're in. And this is something that you'll learn as students in working with your preceptor. What's the right amount of information to give to each patient? As you develop your own practice styles, you will grow more and more comfortable talking to your patients and finding out that sweet spot. How much information do they want? How much information is more than what they want? But in all situations, the key is to tell the truth. This is very much linked to autonomy because people can only make their best decisions about their health and their well-being based on the information they receive. And veracity on the part of the medical provider allows people to make good decisions. The Ignatian pedagogical paradigm is a 5-step process to reflect on something that caught your eye, something that you had emotional response to, something you wanted to think more about. It can be something positive, it could be something negative, it could be something that you just want to spend more time processing. And there's a 5-step model, but my colleagues and I here at St. Louis U have boiled that down to a 3-step model. And this is the 3-step model of critical reflection. What happened back when you were in chemistry lab and you would write a 3rd-person passive voice past tense narrative about an event? That's what the what is. What was a conversation you had? What was a clinical experience you have? What was something that caught your eye in the course of a day? Write it down. So what? Why did that event or conversation catch your eye? In light of your clinical training, how can you apply that lens to that event? Why was it something important to you? How did you move forward with that? What was your response? Were you happy with the response? Were you not happy with the response? What can you learn from the conversation or event that happened? And then the now what, the 3rd piece, how do you pull forward that experience and the reflection of that experience into your professional formation as a PA? When you come across a similar experience in the future, what can you pull forward from your past experience to make this situation easier to work with, more comfortable moving forward? Remember when we talked about ethics before, we talked about it as building the right kind of ruts. And when you build the right kind of ruts, it's easier to fall back into those ruts when you experience a new ethical question or ethical dilemma. It becomes easier to do the right thing the more you do the right thing. And this critical reflection process is useful, as I said, when you have an event or a conversation or something you want to think more about. And it gives you a way to unpack it by considering how does your personal experience, your professional experience in the context of where this event happened, how does that shape your response in the future? Now, this course in clinical ethics, and I have class of 2019, pardon me, I forgot to update it, but this is the first year we started doing this. It's an exciting opportunity to teach each other in the classroom. Again, this is an evolving process. It's a responsive course. It's a way for you to process what you're seeing in your clinical experiences and how you can build off of what you've learned in the classroom. It's a combination of TED Talks, critical reflection, and getting ready for class. The details of this have been put together in a document, which is also shared on Blackboard. Carol and Rhonda and I will be taking turns meeting with you in each of these mega block weekends. Prior to the mega blocks, everyone will watch 2 TED Talks. One TED Talk illustrates a traditional healthcare principle. The second one is a bit of a challenge. It's a variation of the first in terms of a core principle, but it might be somebody who's practicing differently, asking different questions, or may challenge us to apply the ethical principles of healthcare as well as our Jesuit values to question what is our best action moving forward. This is a chance to use all those tools we talked about in the beginning of this talk. And most importantly, it's a chance for students to be comfortable leading discussions in this area. In each of these blocks, there will be a different group of students who will come together to lead breakout rooms in discussion of the topic. Take a look at the accompanying Word document, which includes some questions to prompt discussions based on these TED Talks. We look forward to working with you. And in closing, let me share that other document. Here's the other document of clinical ethics and professionalism. This is the who, what, where. Again, students will be given a heads up when they need to prepare the discussion. All students should watch the TED Talks prior to the session during the mega block. And here are some questions that the students who will be facilitating these discussions can use in prompting what an informed clinical response could be to a given question and to a given TED Talk. We look forward to working with you. Carol and Rhonda will be informing each group before the mega block when they are preparing the discussion. And again, I look forward to joining you during each of these sessions.